We are getting new details tonight about a possible health care deal between Ottawa and the provinces ahead of a key meeting tomorrow between the Prime Minister and the Premiers. CTV's senior political correspondent Glen McGregor on the potential prognosis to a crisis and the politics.
Hi, Premier Smith. What is crossed? Hi, Premier Eby.
A succession of premiers arrived in Ottawa.
Number one priority for our government.
All awaiting the offer.
We're looking at a long-term sustainable funding model for generations to come.
With healthcare systems in crisis, the premiers want the Prime Minister to pledge major increases.
We will be there putting more money on the table, but it's also important to make sure that the focus is on results and outcomes.
In tomorrow's meeting, Justin Trudeau is expected to propose 10 years of increases to the Canada Health Transfer Ottawa sends to every province each year, and separate deals with each province for additional funding targeted to their specific needs. A key concern for Atlantic Canada with an aging population.
That's a massive difference in demographics, and one that definitely impacts the delivery of healthcare and, frankly, the cost of healthcare.
Among the list of federal priorities, primary care, with many patients like Frank McNeil scrambling to find basic treatment.
So now I'm trying to find a walk-in clinic for a simple ear infection, and seems like they're either closed or the wait times are insane.
In return for the money, the federal government wants data, clear metrics that show it's spent on treating patients. But from Quebec, a jurisdictional concern.
We don't need the federal government to tell us how to invest the money.
To some premiers, though, it's the size of the check that matters. To bump up the 22% of Canada's total healthcare costs they say Ottawa currently covers.
For the federal government to, participate to the full degree, the 35% of our healthcare system.
Meeting that target would add about $28 billion to a federal budget already in deep deficit.
We recognize that there do need to be investments in our healthcare system.
There's little expectation the First Ministers will finalize a deal tomorrow, but they'll have to move quickly if any new health money is included in the federal budget coming this spring. Omar.
All right, Glenn, thank you.